Hello, I'm Councilmember Mark Stewart. Thank you for joining me today. Public health, both physical and mental, has been at the forefront of Council's priorities throughout this pandemic. As we've seen vaccines start to roll out across the country and in our community to protect physical health, I wanted to remind the community that we need to continue to actively address mental health as well. With me today is Dr. Erin Krasnow, the Associate Vice President of ASU Health Services and ASU Counseling Services, and Kathleen Dowler, the Director of Community Integration for Dignity Health. I wanted to jump on this live talk with them to really go over some discussion about mental health, trends, resources that we can use in our community, and what we all will be doing to help each other thrive and get through this pandemic. If you have questions about what we're talking about today, we encourage you to drop those in the comments. Somebody from the city staff will follow up and get those questions answered. We'll try to do it in live time as we go through this, but please communicate with us. It's important for us to know how you feel and what you're thinking. So I wanted to thank you both for joining me today, and I think we'll just dive right into the questions.
Sure.
Great.
Thank you. So for both of you, from a mental health perspective, what have been the effects of this pandemic on our community across the country? What are you seeing?
So I'll start, this is Kathleen. One impact is the increased number of individuals of all ages experiencing mental health symptoms related to a combination of things related to COVID, isolation, lack of personal connections, and uncertainty and stress. The result is increased stress and anxiety and, unfortunately, depression. And research-based studies from respectable journals such as Lancet consistently state that 45 to 51% of Americans actually acknowledge experiencing negative mental health symptoms as a result of the pandemic, and probably more if you were to do that survey today. The Sage Journal of Psychiatry recently stated community COVID-related mental health impact really falls into 4 different population categories, which was quite interesting. Our general population, those with pre-existing conditions, those who are our essential workers, from healthcare workers to Amazon delivery folks, and then those suffering from COVID as well. And for each of these groups, the common denominator from a mental health perspective is reduced ability to cope with the ongoing stress and to maintain resiliency over a long period of time. And most of us are familiar with a fight or flight response to stress, but when that becomes chronic over days and months, it actually becomes detrimental to us. And ultimately, all those categories, these groups of folks, can suffer from significant mental health consequences that lead to decline not only their mental health, but their physical health, increased ER visits, increased hospitalizations, susceptibility to the virus, and then unfortunately a lot of people also with deaths due to various causes. So mental health is a really important issue to address as much as the virus itself.
It certainly is, and I think we've all become more aware of that as this thing progresses, and so it's really good insight into what's going on. Dr. Krasnow, what are your thoughts?
Yeah, well, Kathleen gave a fantastic summary of the experience of this country and the research that's showing the mass impact. The only thing I'll add to this, and I think it's really apropos of a conversation like this in the community. I'm a resident of Chandler. I'm really proud to be part of this, so thank you for that. Is that we are also reaching a critical mass in our community of multiple people within families and extended networks, all suffering from some of these same struggles. Where formerly we might have had some buffers of some relatively healthier people in a person's life who could be a source of support, or in its own way, a little bit of herd immunity with the stress response. But with so many more people struggling in the way that Kathleen identified, the amount of helpers in the environment who they themselves may be coping effectively has been reduced. It's not eliminated. There's still quite a bit of support in the environment. It's not everybody who's struggling, but it is one of these unique experiences within our community that hasn't been there for a long time in America. You might see it in communities that experience disasters, where a lot of people are suffering at the same time, and therefore you need supports that are brought into the environment. This is a new thing for most of us who have never experienced anything like this. In the last 100 years, this is brand new. And so we're all trying to figure out, well, if we're all susceptible to this disaster, if we're all experiencing the stress of these things, how do we provide support for each other when we ourselves are going through it at the same time?
Right.
Absolutely. Wow. And when you think about it in those terms, it can it can seem overwhelming, but I think if we continue to have conversations about that and get more knowledge about tools that we can use, I think it's important. Kathleen, what are some of the community needs you've seen in regard to mental health through this pandemic? Have you seen those needs change, kind of dovetailing on what Dr. Krasnow just shared?
I think that a lot of the same needs, but there's more extensive need for those. So for the pandemic and related to COVID, I kind of see 4 key areas of extensive need. One being first, mental health and resiliency resources, rather it be a family member, a teacher, a business owner, a congregation, or a nonprofit leader. People are in need of knowing where to get resources for their mental health as well as for resiliency and keeping up the game with things. They need it for themselves, for their staff, and their patients or clients. And I know that Dignity Health has participated in, as had several coalitions within the East Valley to provide presentations and education and training related to mental health and resources and identifying the mental health symptoms, and then what to do about it once you recognize it for yourself or someone else. And so that continues to be important. A second need that's rather consistent is mental health services. For example, the counseling for individuals and families. Southwest Behavioral Health is an example of an organization that provides that, and we need to continue looking and providing that menu of options for folks. Inpatient and outpatient psychiatric care, drug addiction treatment, all the need has increased, so the needs for these increase. And we're blessed in the East Valley that we actually have some community-based organizations such as Ascend or the Chandler Care Center that help constituents access services, and they know that menu option of lists for mental health and resiliency and other resources as well. And so really that's another need. A third is really ongoing, readily available school and work-based counseling at the schools and universities from preschool all the way up to college. That's a significant need. At the workplace to improve employees' resiliency, productivity, and outcomes. I know here at Dignity Health, we have a rather extensive employee assistance program that is available to our employees on site as well as virtually. And so for a lot of folks, it's looking at how do we do this virtually. And, you know, we have a website page that provides COVID-specific information for employees for themselves or for their families. And I think a lot of organizations now are looking at how to do that. How do we increase the resources for our employees, or not just for work, but for home as well. And then another really important need is connectivity to reduce isolation and loneliness and depression. And our elderly who live alone, our disabled or others who live by themselves because family is out of state or they're working from home and by themselves 24/7. That's an important issue to address as well as that connectivity piece.
Yeah, and connectivity doesn't necessarily mean consuming gobs of social media. It tends to really bring people down, and it is what people really turn to lately to get news, and it tends to be just such. The snooze button is a wonderful thing. I've realized that here recently.
Yes.
So anyway, for those of you who know what I'm talking about, if you're on Facebook a lot, you can snooze people that might be, causing you angst or anxiety, and it's just good for your mental health. You brought up some really good things, and all of that's happening right now, right? I mean, these are needs that are based right now, not only from our older families in Chandler, but also with the youth around the East Valley and especially over at ASU.
Yeah.
So Dr. Krasnow, are you seeing that same effect in youth, and what is ASU doing specifically to help support that community?
Sure. So I love the way Kathleen laid out those 4 areas because they graphed on really well to the roadmap of how we're responding to our community at ASU. And also, as you all know, ASU, as part of our charter, it takes fundamental responsibilities for the communities that we serve. So we see our boundaries beyond our college students and those, but we see it as a member of the cities and the state, of course, the country and the world at large. And so we're also looking at ways to basically extend our support and resources the ways that Kathleen just described. When it comes to youth, one of the things that's happening right now, just to flesh out a couple things that Kathleen said, particularly for young people, 'cause I just love the way you put those in that structure. As it's happening for young people, is that the stressors of the pandemic and the associated economic and social consequences of it can be both a trigger of a new stress response, and it can be an exacerbator of an existing struggle. And so families and communities who are responding to youth have to be prepared for those two realities, and they may show up in ways that surprise them. So you may have a child who historically has been quite basically unaffected by stress. There are just some kids who sort of roll with things, and that this experience has been a triggering event for a reduction in functioning or some difficulty with coping. And for a family that's never experienced that with their child, or a community who sees that child in a certain way, and that they've always been able to kind of wrestle through tough times, maybe they've always just, put on a happy face and grinned and bear it, or they're a star of a team, they're the lead in the play, they're these high performing people who have these struggles. Those families and communities sometimes struggle to recognize individuals who've historically done okay who are now struggling. There's sort of a dismissal at times for those individuals, and I'm like, they'll be okay because they're always okay. And yet this experience of stress is so different, and you never really know what kind of stress or trauma is going to trigger that response in people. We need to attend to those people that historically have been, quote, okay, and really attend to this being a triggering event for difficulty, and then give them the supports that Kathleen laid out. We do that at ASU by connecting across everybody, but not presupposing anybody's capacity to do anything, and just be ready at a moment's notice to be responsive, to create those connections across students, and from us to the students, to build that connectivity that Kathleen talked about, which is more than just providing counseling to them, which of course I'm responsible for the counseling and health centers at ASU. We have all of that, but this is a broader strategy. This is about that connectivity. And the last thing I'll say is then there's the members of the community, as Kathleen mentioned, who were struggling prior to this. And this is an exacerbating stress and trauma for them. And they may have already been maybe working with professionals, or maybe struggling to find a professional to do that. And this has made it even more difficult at times. So the way we tackle that at ASU, and what I would recommend to any community, is you got to live in the reality of that. We have to really acknowledge the true impact of these things. Kathleen named a number of stats in this regard. When you start to do the scale, you start to do the math in your head, what 50% of Americans, right? 50% of a community, 70% of this, 30% of that. You start to do those numbers, and you start to graph that onto what would you really need to do. Of course, we need more counselors. Of course, we need more doctors and nurses. Of course, we need more supports in the environment. But the only way to truly do this at scale is actually through the populace. Is to recognize that this is something that is endemic in the community, this stress, this struggle, and that we have to take a community-based response, which means we're all responsible for it. Now, there are things that professional counselors, I'm a psychologist by trade, there's things that I know how to do that most of the population doesn't, but that's why I'm licensed as a psychologist to do that thing. But that's a narrower band than what the community needs. I do one thing that's helpful, and the whole community needs to do other things. We need to do that connectivity. We need to live in the reality that people are struggling. We need to acknowledge that I might not be okay and my neighbor might not be okay. And we need to be ready that if I am able to help, I can help. And if I need help, to ask for help.
I think that's, I think you just hit it there, right? It's okay. We're all getting through this, and you're right. I mean, what you said was some people that have always been able to deal with anxiety may not be in this particular case, and that is systemic across the entire community. And we've got to recognize that it's okay, and we also have to recognize as a community that it doesn't help sometimes with some of the things that we put out online, and it doesn't help with constantly trying to beat people over the head with what you think this thing has become, what it is and what it isn't. Doesn't matter. It is here. And we have to be responsible to one another as it relates to how we treat each other, because that's a big factor in this anxiety that we're all feeling. And then the other thing to remember, and sorry to hijack this, but our healthcare workers and first responders are feeling the same thing.
Absolutely.
They're living this every day too, and we forget that. And so it's just important to be mindful of that. And so those are some of the challenges that we're facing. Kathleen, do you think that are you seeing the same challenges from administering mental and public health? Or are you seeing, what are you seeing there?
Yeah, before I go on that real quick, I want to say I appreciate the conversation about the self-check-ins. I think there's probably 100% of the population being affected in some way by the pandemic mentally, regardless of what format, probably 100%. The other thing is there's a lot we can do to help reduce other people's stress and our own stress, whether it be through the social media, what we say, what we do. A lot of what we say and what we do does make a difference, whether it's in person, whether it's virtually, or rather, however it is. And how can we reach out to someone that might be lonely? How can we reach out to someone we hadn't talked to in a while? And can we have that kindness? I mean, we say dignity, health, hello, human kindness, but really, I think we need to create a kinder society in order to help us move through this mentally as well. And to address your question on some of the challenges the pandemic has created in administering mental public health programs, I would first again go to the technology and shift from in-person to virtual. Healthcare providers and system had to, on a dime, move quickly into the telemedicine approach for safer care. And as such, we also have to work through some of the regulations related to telehealth and to provide better mental health and behavioral health. And luckily, there's some legislation that's going to be introduced this year that will allow patients more options and flexibility to receive behavioral health services through telehealth. And that's a long time coming and very important. And then our second challenge is public perception of COVID. Despite strong education and efforts, many still believe the vaccine will give them COVID, or they believe the vaccine in general are harmful. So we have to do a better job of educating on both of those fronts. Another challenge has been encouraging the community to stay within the safety precautions, such as social distancing, such as hand washing and wearing a mask. If my 4-year-old grandchild knows how to wash their hands for 20 seconds, then adults should be able to do that too. And this is all important, and we have to maintain the game, even though it's difficult, until we get the pandemic under control. The breach of the safety standards for events and holidays have direct correlation, unfortunately, to increasing positivity rates, hospitalizations, and deaths. And we're not going to reach herd immunity and get our society back to a normal state unless we get more people to participate in the vaccines and those safety precautions. I know this morning I look at the stats a couple times a day, and we're at 389,000 cases in Maricopa County and nearly 700,000 in Arizona as of this morning. That's pretty significant. So that there, and then finally the logistics of the pandemic. When we think about, you know, our county and state are working 24/7 in order to prepare for getting through this pandemic, you know, the education, the vaccine testing, the COVID vaccinations to over 4 million in our county. That's an immense task that we had to take on. The county right now has several pods that it's running. We just opened a new one as well at the stadium, and they're drive-through pods for distribution of the vaccine. And this is a collaborative with the hospitals, with Maricopa County Department of Public Health, with the National Guard, site partners, colleges and universities, students and volunteers. Massive effort to get people registered and get them through the process and checked in and get their vaccine and have them observed. All that processes and all those stations are so important to maintain those practices and those processes, which everyone is doing quite well. The challenge is to be able to maintain that significant amount of time and resources over a long period of time to get the community safe. It's well worth the effort, however, for sure, but it's the long stay that will become the challenge.
Now, Dignity is offering some mental health resources currently, right? I mean, you guys are doing something as it relates to helping the community. Is that correct?
Yeah, we have quite a few mental health programs and resources. Number one, someone can just go onto our website, and there's COVID-19 information on symptoms, treatment, and statistics, and how to be safe. We also help people to know how to connect with their doctor virtually. I run a community grants program that provides grant awards to nonprofits in the community addressing health priorities, and mental health is always a priority, but this year we also allow them to address issues exacerbated by the pandemic. And so we actually had 3 or 4 grantees that received award money in order to address mental health, resiliency, substance abuse. The 3 that come to the top of my mind really are Brave Connections with Arizona Recovers as the lead agency. They're providing peer support and case management for identified patients with mental health and substance abuse and suicidal ideations. East Valley Perinatal Network is providing resources to moms and babies and dads for with their collaboration for parent support and counseling and access to treatment and needle abstinence syndrome treatment as well for those neonates. And then we have the Youth Mental Health Collective, which is led by Not My Kid, to address youth mental health and provide training for identification of those youth and also for them to be able to identify some of their friends and again, understanding how to resource for them and talk to them. And then at Dignity Health, we have a plethora of support groups and classes that we provide as well, postpartum depression, perinatal mood therapy. So those folks always needed that help, and they need it even more during the pandemic.
Mm-hmm.
We're going to be starting, we hope, in the next few months, a program called Mind Over Matter, which will be free, a 6-week course under our Healthier Living program for folks to receive additional support. And then we also have collaborations with Chandler Gilbert Substance Use and Treatment Task Force and Arizona Suicide Prevention Coalition to run classes. We were doing them in person. We've had to switch to virtual, but mental health first aid is being provided. Talks Saves Lives is being provided. And these sessions, again, help to provide research and statistics and how to identify someone, how to talk to someone who they're worried about, and how to reach out for help. And then we have what's called our embedded programs, continuum of care programs in the hospital. A couple of them related to mental health is with Arizona Recovers for an embedded navigator that identifies and resources for patients with mental health, drug addiction, and risk of suicide. We just started Zero Suicide, which is a national program that I think we may be one of the first, if not the first, in Arizona implemented in our ER to provide support and recovery post-discharge. So, you know, they can contact myself for any of those programs at 480-728-3458.
You know what, that is amazing. And it's a testament to community partner that Dignity has become over the years, not in just Chandler, but in the East Valley overall. That kind of commitment to what we're talking about today is incredible. I will tell you this, we're going to get all that information into the post that we're going to add, and make sure that it gets added.
Sure.
So that people can have access to that and share it with their friends, et cetera. Because we are going to grab hands, and we're going to hold hands, and we're going to try to work through this.
Right.
And understand that it's okay. It's okay. We're all dealing with this
Right.
the best we can. But
Right.
man, it's like, you know, maybe a bad analogy, but spring training will be delayed this year, but I know that when people have trouble hitting a curveball, they go and they get training, right? They get coaching to figure out how to hit better, and that's okay. You don't just have to figure it out on your own. So those resources are going to be incredible. So thank you for that. Dr. Krasnow, what are you doing as it relates to mental health during this time for our friends and family and neighbors? What are some of the advice that you have for us?
Sure. You know, that list of incredible resources that you just heard, that has to be top of mind for people because you're not 100% sure when you might need it. And so it's tremendous that you heard about it today and that you're going to have those resources listed, because then people can bookmark it and go back to it, because that tends to be how it happens. It kind of comes in, you hear about it, say, that sounds amazing. That's what just happened with me. But I'm thrilled to hear about the Zero Suicide effort. You are one of the first, if not the first in Arizona. That's so great. Yes. I'd love to get involved in that. Like, these are amazing things. But there, it reminds me of something. And, you know, Councilman, you talked about analogies, so I'm going to use one as well. There's an approach that comes from public health about trying to figure out where you fit in the response to a public health issue. And there's some things that only a few of us can do. I talked about being a psychologist. It's a narrower band. There's some things that many of us, but not all of us can do. And there's some things that all of us can do.
Right.
So what not all of us, even on this Zoom, are members of a city council. One of us is. And in that regard, you have this narrow but incredibly important role that only a few people can do, but it can have very large impact, right? So you can make big changes and you're part of a policy and an impact on the community, but there's this tiny group of people can do that. And I think sometimes people forget that, like, I'm not a member of that. So I have to rely on people like you to help our community. Then there's a whole group of people, I fall into it, Kathleen does as well, who are professional groups who run these programs It's some of us. It's a larger number of people than are on a council, but it's still not everybody, because not everybody's running these programs. Not everybody's a psychologist. Not everybody's an expert in doing these things. So there's a large group doing that stuff. So then what can all of us do? Everybody who's on this Zoom and everybody in the community. Well, here's the analogy. It's a little bit like littering. All of us, almost all of us in society, not 100%, but almost all of us in society have decided not to litter. Now, me individually littering by itself has minimal impact on the environment and minimal impact on the aesthetics of the community, almost none. You might not see me do it. You might not see the can I threw away. Maybe you do, you kind of brush it off. But little things like that, compounded across lots of people, starts to have an impact. We have a social contract in that regard that almost has completely eliminated littering from society, or our community anyway. As a result, when you see someone litter, it looks weird.
Mm-hmm.
It jumps off out of what you're looking out the window, someone throws something out of their car, it looks bizarre. You see people who are paid to pick things up, and at least for me, I think, I can't believe people still litter. Like, how does that even happen? Maybe it blew out of a truck, but I think there's still some people littering. This is a small group. Now, I didn't decide with you, Kathleen, and you, Mark, that, you know what we should do is not litter. We didn't have to have that conversation. We decided that we live in a better community when I don't litter, and you don't litter, and you don't litter. And together that has built a cleaner, more aesthetically pleasing environment for us in our community. Now that was built over time. That takes time to build that ethic as a community. But that's an example of something that all of us can do that's little, but compounded has this massive impact. It's not the same thing as policy. You set policy as a member of the council. It's not the same thing as services. There are groups of us who can do that. But there are things that all of us can do individually that brought together has incredibly outsized impact. And those are the mitigation strategies that Kathleen talked about. Those are being kind to each other. Those are being responsible online and in person. Those are ensuring that those most vulnerable in our communities have the support that they need. Yeah. Those are funding the resources for those who might need it. Those are those things that all of us do individually that across all of us has the biggest impact at all.
Well, it's perfectly said. And I want to go off script here a little bit because we need to wrap up. But, you know, that social contract that you talk about is a great analogy. It just genuinely is. I think we all have to be committed to trying to help one another through this. And we can have our own belief systems or whatever you want to call it. But at the end of the day, there are people that are suffering because of decisions that we are making online or whether we're making it in person. And we have to be conscious of that because there's a ripple effect. And so I wanted to step out here, and we talked a little bit about suicide. It seems to be something that is not being talked about. And I don't know why, and maybe we can broach the subject here briefly, but what are you seeing out there, and what can we do immediately for these kids that are struggling with that connection that we were talking about earlier? Kathleen, you mentioned that.
Yeah.
Right?
Well, it is. Yeah. Well, number one, it's a huge issue. Teen suicide is a very big issue in the East Valley in particular too, as we recognize that. And there is local coalition work going on to help address that, working with the schools and the high schools and the colleges and working on getting counselors into schools. I think we have to start with, understanding the kids and being open to hearing from the youth, what are the triggers for them. We as adults sometimes make the assumptions that we know what's going on in their heads and what's bothering them. And the reality is we don't always know that. And we make false assumptions on which population is most affected. And the reality is that some of those children that we think would be least affected are the most affected. So I think we have to do our homework. We have to talk to children and parents and youth and allow them to help the community come up with the ideas that will help make them healthier and better. So they feel comfortable reaching out for help. You know, there's going to be that comfort level to reach out and have those friends that will say, if I see something, I'm going to say something. And the understanding of the demon of the social media that can negatively affect them to the point of wanting to take their own lives. But addressing the social impacts of the COVID pandemic and in society in general, all need to be looked at and in regards to addressing this. And it's all hands on deck approach as well. Everyone has a say and everyone has a responsibility and an opportunity to help make our youth healthier. And it's just a very important issue that we need to address.
Doctor, do you think, like, what's the one technique that every parent and maybe even a peer group can use to sort of broach that subject comfortably? Because we're at a critical point, and I think we got to tackle it head on. It's one of those things I think we all try to, okay, let's talk about something else, but I don't think it's time. It's time to really face this.
Yeah. One technique would be, if I had to pick one, would be if someone is struggling, you should believe them.
Yeah.
And there's so much that's part of our societal dismissal of not just suicidal thoughts and behaviors, but actually just emotions in general.
Yeah.
We have a ways to go to allow for people within their families, within their communities, to have a range of emotions, some of which are very difficult. And so when someone is struggling, whether they're literally telling you that, which actually lots of times people do, and they're ignored or dismissed, or they're given a sort of a sympathetic response, like, yeah, things are hard, and then people kind of move over. What people need to know when they're either through their behavior or through their words, what they need to know from other people is that they're being taken seriously, and they're not going to be rejected for it.
Right.
And so lots of families think, I would never reject my child for it, but the rejection sometimes can come in just in the little bits of dismissal or we'll talk about it later. And what children are looking for, what all of us are looking for, is that if I express an upset, whether literally like I need help or something in my behavior, I need somebody else to pause long enough to acknowledge my humanity in that moment, which reminds me that I'm not alone. The isolation and the feeling of intractable pain, those are the suicide risks.
Yeah.
The feeling like you're not connected to others, that this is not going to end, and that nobody understands me, and therefore I'm totally alone in this regard. Those are the big risks, at least in the social context. So pausing long enough to just be with somebody, to show that you are there, even if the person doesn't want to talk to you about it, which is fine. It communicates that I am available to you. And that is often, just by itself, enough to give someone a little bit of space to maybe open up some more, to have the courage to seek help if they need it, to try again, because lots of people have sought help, it didn't work or it went badly, and we want them to try again, but they had a negative experience, and we got to get them over that hump again. Just someone with them is often enough to help them in that regard.
Yeah. Thank you. That was terrific. I think too, sometimes people are afraid of saying the wrong thing, so they do the inaction, and that sometimes could be the wrong thing too. So you may not get it exactly right, but it's the reach out sends the message that you care. So I think that's another thing too.
Well, if this conversation opens up or helps people unpack some information, or gives them a tip or a trick or something that can prevent the stress that people are feeling, or to help console somebody or to prevent a suicide from one of our wonderful kids or even adults, then this time is well spent.
For sure.
I want to thank you for joining us. I think we're a little over time, but this isn't something you could just start talking about and cut it off at a half an hour, right? You want to chat, we want to unpack these things, and we want to be able to help the community. And I'm just grateful that you spent some time with us today, because we'll continue this conversation about mental health. I think it can go on for a long time. So I may be reaching back out to you, down the road here.
Sure.
The city has a COVID-19 webpage, and there's helpful numbers, there's helpful links. Kathleen, we're going to get all that information from you to make sure that we get it on our website. We'll add it to this feed somehow. And then I think it's most important, and I want to leave you guys some final thoughts here, and then we'll close it down. Just continue to check in on your loved ones through this, to see how they're doing, and stay connected. And we'll get through this. Do you have any final thoughts that you want to share?
Sure. Yeah, this is Kathleen. My final thoughts really are that we have people that have always struggled with mental health issues, and that will continue to struggle even more so during the pandemic, which is why the more frequent check-ins. But we have people that have never struggled before that are struggling now. And so when I talked earlier about reach out, a letter, a note, a call, a text, all those things, that one extra step you take can make a huge difference in that person's life, and help again, as Aaron alluded to, how can we as a society take social responsibility and build a contract with ourselves on how we're going to do one additional thing a day to help someone else's life a little bit easier from a mental health perspective. That will go a long way.
The only thing I can add to that is, as it relates to young people, many young people in the coming generations are fantastic at everything that Kathleen just said. They're actually quite good at caring for each other, checking in with each other. They're much more open about their mental health struggle and normalizing it as part of the human experience.
Yeah.
And as you get farther from that generation, there's a tendency to reject that as somehow inappropriate or oversharing, and actually what they're on to there is finally breaking the veneer of the stigma associated with real human experience and real human emotions and struggle, and reminding us as we observe them and talking about their diagnoses, their emotions, their friends who are struggling, their struggles. What they're reminding us is that's a whole human experience, and that the rest of us have been living this truncated human experience, and we've been trying to just grin and bear it or gut out a life. And they're reminding us that actually a whole life includes both the highs and the lows and the ability to share that with others. And if we could see that as a model for us, I think we can get through this not only through toughness, but with that care and kindness that we could do as well.
Doctor, that's outstanding. I've said more than once that I think this generation that's coming up right now is going to be the next greatest generation because of what you just talked about. Their ability to for so many different reasons. And I'm just grateful that you all spent the time with us today. For anybody that has questions, please leave them in the comments. We'll do our best to get back to you. And we're all in this together. We'll all grab hands and we'll keep plowing forward. And just send a text to a friend today, and we'll leave you on that note.
Great, thank you.
Thank you very much.
Thank you.